Well, the recent deaths of fashion designer Kate Spade and journalist Anthony Bourdain shocked the world earlier this month. It has also opened up discussion for something that many shy away from talking about. Experts say suicide is still considered a taboo topic, but we must talk to others about it, especially if we think they may be considering taking their own life. Helping us understand how to do that is Dominic Litzy, Adventist Health Castle lead chaplain. Good morning, Chaplain. Thanks for joining us.
Good morning. Glad to be here.
Now, suicide is usually treated as a taboo topic, and a lot of people don't really talk about it, but is it something that we should talk about?
You know, definitely we should be talking about it. Unfortunately, there's a lot of fear surrounding the topic due to the stigmas placed upon it by our faiths, our beliefs, and by the social and cultural perceptions of mental health. We can't be afraid, though, to ask the questions, the important question of, are you considering hurting yourself or killing yourself? It's a hard question to ask. It's difficult to talk about. But once we are able to ask that question, we are able to then take a big, important step towards hopefully preventing suicide.
I know it's even tough for us to talk about it here, but we do need to address it. What are some of the reasons, or could be some of the reasons, people might be thinking about it? What are some of the signs?
You know, there's no real definitive list. It's a broad topic. Experts, you know, they just don't quite understand everything that contributes to it. And there are quite a bit of factors as well. So one of the big ones, though, that's been identified is something such as a depression or anxiety disorder. Because feelings of, you know, that the world would be better off without them, or that death is the only escape from their pain, those come along with severe depression and anxiety disorders. Other aspects, they kind of seem insignificant, but they do play a vital role, and that's something such as a lack of proper nutrition, a lack of proper sleep, lack of proper exercise, and your spiritual needs such as, you know, companionship, love, support, and a sense of purpose and meaning, you know, just not being met.
What do you say to someone who might be watching, who might be thinking, this is the only solution I have to my problems?
Yeah, you know, I would say that it's not. It's not your only solution. There are some people out there that say, yes, it is. And there's still some discussion going on around it, but the vast majority would say, no, this is not the only solution that you have. There is hope. There is, you know, as a chaplain, I find hope in my faith. And moving forward, I find that when I'm struggling, when I'm having difficulty, I can find support and strength in my faith group. And it's important for people to remember that they're not a burden.
And there is help out there, right?
Yeah, there is help out there. People, you know, when you're remembering you're not a burden, you're remembering that there are people out there that love you and support you and want to be there for you, no matter who they are. Their friends, their family, their strangers on the street. Other help, you know, some of the more popular help is the support lines. So we have the National Suicide Prevention Line, and we have the Crisis Line of Hawaii. Both of those can be reached via phone number, and I think we're going to be posting those on your website. And those provide people that can respond either via the phone for counseling or respond to your location for crisis intervention. But if we're in need of immediate help, it's best to go ahead and call 911 or go to your local emergency department. And at the emergency department, you'll be met by someone who is trained to respond to your situation and help you through it. And then if they decide that, you know, maybe it'd be best to stay in the hospital a little bit longer, you would then be transferred to one of the two behavioral health service providers. One of those is Adventist Health Castle. And once you'd arrive at Castle, you'd be admitted to the behavioral health unit. And you'd be met by people that love you, support you, want you to succeed in your future. But, you know, sometimes those aren't the best options for people right away. So simply going to your family, going to your friends, reaching out and letting them know, hey, I'm struggling. I'm having these problems. Can you help me?
Now, speaking of family, what if you need to address this with your child or your teen? Not necessarily they're going through it or they're considering, but they're seeing what's happening in the news and they want to understand or try to understand, why do people do this? And they ask you, what do you say to them?
It's a good question, because talking about anything this serious with a child is difficult, because, you know, the level of understanding isn't quite there. It's important to remind them that everybody struggles with things. Everybody is having a difficult time with various things in their life, and being honest with them. You know, talk about what it means to commit suicide, what it means for the families, what it means for that person, and remind them that, you know, there is always hope. There is always something to look forward to, and there's always somebody around to support you.
Okay. Thank you so much,
Yeah.
Dominic Litzy, lead chaplain at Adventist Health Castle, for helping us to talk about this, because it is a tough topic, but like you said, it's a topic that we must talk
Yeah.
about. All right. Thank you for being here.